Women who experience complications during labor are at an increased risk of developing postpartum trauma-related symptoms and responses, regardless of whether they have a history of prior trauma or not. This can be due to a variety of reasons. For starters, women may perceive complications as threatening to either her own or the baby's well-being. Also, in emergency situations, there will be many medical responders from a variety of specialties, which can cause confusion and concern for the patient. Finally, severe pain and other physical symptoms can trigger or intensify the body's threat detection system. Because of that, it is critical to utilize a trauma-informed approach in settings like unexpected C-section or an emergency team response. In doing so, we can minimize the risk of triggering or re-traumatizing an individual with a past history of trauma, as well as mitigate future trauma-related symptoms in women who experience the labor complication as traumatic. Fortunately, incorporating a trauma-informed lens does not require additional time, and it is likely that you are practicing many of these steps already. By using Mirror, we can quickly bring to mind a set of tools that will minimize trauma-related symptoms. Let's see this in action.
Hi Sarah, my name's Jessie. I'm going to be your nurse. Right now, we're starting medication to induce labor because your blood pressure is very high. The good news is that your cervix is already dilated, and that may help the labor progress. Are you having contractions yet? Okay. The medicine we use to induce labor can make contractions more painful. If you decide to have an epidural, we can call anesthesiology at any time to get that started. I'll be here for the next 12 hours. If I'm not in your room, you can reach me anytime by pressing this call button. I understand you weren't expecting to be induced today. This situation can feel very scary for patients and families. But I want to assure you that you're in great hands and that we're keeping a close eye on you and the baby. So far, the baby's heart rate is looking great. Looking at the monitor, your contractions are becoming more frequent. Can you feel those? Would you like me to call anesthesiology to discuss the epidural at this point?
You can see that standardizing the trauma-informed process does not add extra steps nor time to our intervention. Instead, we can weave Mirror into the approach we are already taking, and in doing so, protect against re-traumatization and long-standing trauma-related symptoms.